Everyone, it's Josh from Prescription Fitness Physical Therapy and Sports Care. I thought I'd do a quick video tonight looking at the anatomy of the lumbar spine. One of the big things we see here in the clinic are spine-related injuries, which are very common. The good news is that most of our spine-related injuries will resolve on their own within 6 weeks as long as we do the right things for them. The problem is oftentimes we don't know what the right thing is. So when we look at the vertebra itself, when we look at the spine itself, so here's a small replica model. What we're looking at, so this would be me facing towards you. If I turn around now, I'd be facing that way, and we're looking at what's called the spinous process, which is the attachment point of a lot of the muscles. And if we look over here, these are what are called the transverse process. And transverse process, again, this is an anchor point for a lot of the muscles that control the function and position of our spine. If we look more into the front, we see the vertebral body. What we have here is an intervertebral disc. The purpose of the disc is multifold, but one of the big things that it does is it maintains the space between the two vertebrae. So the bigger our discs are, so if we can see the space right, I'll show you with a little pen. So we're looking at the space right there. Okay, that's where the nerve root exits from the spine. So from this view, you can see we have the spinal cord on top. Spinal cord comes down and then it exits through these little foramina, these holes on the side. So if I can make my disc bigger, such as when I'm younger, I can see that that foraminal space would get much larger. Now, unfortunately, as we get older, all of our discs start to collapse down and we start to get smaller. So that's why if we were to measure our height first thing in the morning and then we were to measure it again 12 hours later, we'd actually see that we're actually shorter because the vertebral height collapses as we lose some of the water during the course of the day, but also over the course of time, the discs themselves start to flatten or degenerate. So foraminal space being large, when we're healthy, nice healthy disc, as everything gets smaller, the discs start to collapse down. We see a change in the size of that foraminal space or that opening right there. So when we hear about things like degenerative disc disease and spinal stenosis, so the statistics are basically this. By the time you hit 60 years old, 95% of asymptomatic individuals, that's people who don't have any pain whatsoever, have things like spinal stenosis, spondylosis, degenerative disc disease, arthritis. So we kind of make a big deal of all those things and we think that's the catastrophic end-all be-all. But if everyone has that, then it just means you're lived to 60. Well, congratulations. So don't think because you have those things that necessarily means that that's where your pain is coming from. So we need to be careful. Again, this goes back to my point about diagnosis and diagnostics, that you really need someone to do a thorough evaluation to really determine, what is going on, what can I do to fix it. So if we have arthritis and degenerative disc disease, sure, it can cause our pain, but a lot of times it doesn't. It's just an incidental finding because we're 60 or older. And you can certainly have these things when you're younger too. So those are some of the common things that we see. So changes in that disc height causes things to collapse down. Certainly in the back, we have what are called the facets, or the facets, the joint, which kind of controls the motion of the vertebra. In between this is a fat pad, and sometimes we pinch the fat pad, and that can give us an acute pain. Or surrounding this whole structure, surrounding the joint, just like the joints of our shoulders or fingers, is a capsule. Sometimes the capsule can get strained. That kicks off the muscles, and the muscles guard and protect, and that sort of gives us that acute back pain that most of us have had in it, and it's pretty miserable. So the treatment of these types of things can vary depending upon what we think the problem is. So being a really good historian is helpful for all practitioners to try to tease out what is cause and effect. And if we can figure out cause and effect, then very often we can come up with a clinical model or paradigm which helps us treat this. So that's just a little quick insight into the lumbar spine. We all have one. Just because we have discs that have degenerated doesn't mean that we're going to have issues related to that. So don't be sort of misled that your MRI says I got a disc problem. Oh, and nothing I can do, because you can. So again, this is Josh at Prescription Fitness Physical Therapy here in Geneva, New York. Send us any questions you might have to our Facebook site.